This is our third year here in Kent County doing Kent Goes Purple in conjunction with the Rotary Club, the Chestertown Rotary Club. And Kent County Behavioral Health is now a partner along with the Prevention Office. And Midshore Community Foundation has also been a very good partner with us in this initiative. This being our third year, and with the COVID-19 issues, the pandemic, it's made it a little difficult this year. Obviously, we don't want to have any in-person type of events because we don't want to put anyone at risk of being, getting sick or we want to keep everyone healthy. So what we've decided to do this year is to pretty much go virtual with everything. We have a very active Facebook page, Kent Goes Purple does. We're putting up a lot of educational messages on there for parents and folks to look at. Kent Goes Purple really is about educating the community, especially our youth, in hopes of preventing them from ever even partaking in any type of addiction type of behavior. We've done that this year. We've also have a number of banners that we're putting up throughout the county, just little short educational type messages to remind folks and to help parents educate themselves to engage in conversations with their own children. Because I'm a firm believer, and I think the rest of our group is, that if we can educate our youth, that's a good starting point.
Yeah, that's really...
As you know, there's a lot of organizations, groups that provide services to folks that have addiction issues. And because of the pandemic, a lot of those resources haven't been readily available in person. So, I wouldn't say we've seen a huge increase, but it hasn't gotten any better. Last time I checked, there were, I think, a total, comparing the same period to this time last year, I think they had 48 cases last year, and we've got 49 as of just this past weekend. There are 7 overdose deaths as a result as well. And like with the pandemic, I mean, not just with addiction, but with a lot of things. People are struggling with mental health issues. Some folks are, and it's been a very, very difficult time. You would think that we would have seen a increase in crime here in the county also. We're not really seeing that. Folks in Kent County, and I'm very, very proud of this because this is where I grew up, and I think we have a lot of good folks here that live here in the county, and they respect law and order. And at the same time, we don't have a whole lot of burglaries going on, thefts, things that you would think people would be out there doing, committing criminal violations to support a habit. We're not seeing that here in the county, which is a good thing. The biggest concern I have right now is I've noticed that there's, and I had the same discussion with our county commissioners about a week ago at one of their meetings. I am very concerned about the serious accidents that we're seeing on our roadways here in the county. There's a lot of distracted driving. There's a lot of people driving when they shouldn't be driving because they've had too much to drink. And people are exceeding the posted speed limit in a lot of these cases. We've had, if I remember correctly, at least 5 fatalities, which is pretty high compared to years past, and that's alarming to us. So what we've done, we've asked the Maryland State Police to provide some additional coverage here in the county, especially on our Maryland state routes. And I've also put extra deputies on the road to do speed enforcement and to look for any distracted driving or whatever. Yeah, last year, in the United States, 70,000 people died as a result of opiate-related overdoses. It continues to be a problem here in the county. It continues to be a problem nationwide. We're doing our best with our Kent Goes Purple program to try to educate the community, as I've said, and our enforcement efforts are stepped up as far as we can step them up at this point. with the COVID situation. That's kind of been hard to do with the COVID pandemic type of situation. I had a number of motor vehicle collisions on Route 20, a lot on 298, some on 291, and we're just trying to, get people to slow down, pay attention to what they're doing, and the cell phone use while they're driving and texting or whatever and driving is just totally unnecessary, and it really puts not only the person doing it at risk, but maybe the family that's coming down on the other side of the roadway. I'd also like to share that with Kinko's Purple, we have drop boxes around the county. We have one here at the Sheriff's Office, one at the Chestertown Police Department, and one at the Rock Hall Police Department, where we encourage folks who have unwanted medications of any type that they bring these to the drop boxes. It's important to safeguard your medications in your home and to hopefully keep your grandchildren and your children from even having access to them. So, I would encourage folks, the boxes are very easy. You just pull up out front, step out of your car, drop it in the box, and then we properly dispose of it from there. But I think that's really important because a lot of our addiction issues with our youth start in the home. Data has actually showed us this, and it starts with alcohol, tobacco, marijuana, and some other things, and then it goes to prescription pills. The next thing you know, they're going to the street drugs with the fentanyl and the heroin and so forth. So it's important to eliminate that access to our youth.